Polynucleotides are essentially fragments of DNA. The ultimate way is what I call a dermal restructuring.
If you've heard of the longevity Bible Lifespan by Professor David Sinclair, you know that living well is more important than just living long. In fact, this show is dedicated to the science of beauty, wellness, and longevity. That's why I'm so thrilled to partner with Melrose Future Lab for Season 9 of the Ageless Radiance Club podcast. Future Lab is Australia's first supplement range focused on extending not just your lifespan, but your health span. Available exclusively at Chemist Warehouse, these affordable and science-backed supplements are the key to aging well. Today, I'm excited to share Dr. Stephen Liew. We welcome him as our latest episode will explore the new frontiers of regenerative and skin enhancement in aesthetics. Today, Dr. Stephen Liew, a globally recognized specialist plastic surgeon and the founder and chief medical officer of Shape Clinic in Sydney. Dr. Liew is not only one of Australia's leading plastic surgeons, but also a recognised global leader in cosmetic facial enhancement techniques, a key opinion leader for skin technology and skincare brands, and the founder of Aesthetics Conference in Australia. Having trained as the first Australian Fellow in Plastic Surgery at the prestigious Memorial Sloan Kettering Medical Centre in New York, he specialises in both face and breast aesthetic surgery. Dr. Liew has also developed innovative non-surgical procedures that have revolutionized cosmetic treatments worldwide, enhancing his international reputation.
Probably almost like the definitive way to deal with the aging process. But in between, there are a lot of things that will help us throughout our journey, because every one of us do reach that stage at some stage. And for those who are concerned, I think what I am particularly interested, and the buzzword has been, it's going to be a regenerative type of medicine, to give your audience a little bit of perspective in the non-surgical world. We always have devices. We have devices like laser to improve our skin qualities, and that's progressing very, very quickly. And then we have also the sort of a tightening devices, and we have seen them getting better. We're not there yet. And then we have the lifting devices that is very, very exciting. And I think we will see an explosion in that area, particularly dealing with the muscle, to deal, working on the muscle level. Regenerative opened a big area. Now, with aging, we see a lot of skin changes. We see the drooping. At the fat level, we see the loss of fat, and that's why we look a little bit gaunt, right? We're not as plump. And then the bone is probably the area still we have not have the technology to deal with. And I'll talk a little bit about the bone in a minute, because the bone is the foundation. If we can actually maintain the structural integrity of the bone, and I think we will hit it. And I think there are some things that we can do about bone. So if I forgot, please remind me. In terms of non-surgical, for a while now, we talk about a thing called biostimulation, right? So essentially what we do is we want to use something to stimulate our tissue to produce more collagen. Now, the end result is very good, and we have seen good product. And what it does is we get better skin quality, a bit of tightening, a bit of dealing with laxity. And the way it's done is by the process of creating an inflammation, creating a soft scar tissue. Now, by and large, it's still very good. But now, move on to 2024 in the next 10 years, we talk about regenerative medicine.
One of the things that I found about this technology that was really exciting to me as a consumer, and I've had a treatment that uses salmon DNA, is that I was actually for the first time able to treat, as you were saying, and this is what's inspired me to talk about this, the really thin skin under my eyes and even the really thin skin above my eyes. And I've never been offered a treatment that can go into those areas. Maybe PRP did it, but never before something that's going to truly redensify that skin, that's going to boost the collagen, that's going to create a repair mechanism. And I think that for me was a really amazing upside of this new technology.
So you're absolutely right. I mean, the eyelids is probably the most delicate skin throughout our body. And the reason for that is it does not have a lot of sweat gland, oil gland, and it's very thin. There's no underlying fat in it. That is why if you think about the eyelid, the next one is your neck. So, I mean, if you look at it, women spend a lot of money on those super rich cream into the eyelids and neck, of course. So this thing like that is what we're trying to do is restore the structure. The other thing, apart from the crepiness, the lines, and the wrinkles that we're looking at is how to do with a dark circle in that region. And in fact, I am in the process or have started the process of looking specific way to deal with what we call an unmet needs. A lot of patients come in, they have a dark circle even at the age of 25, 26 because they are born with a very thin skin. So if you think about combination therapy, any regenerative medicine, particularly the cell and DNA, first of all, they like to heal things. They are a healer. I mean, that's what a stem cell does to us. It's something that we're going to repair. Aging process, most countries, in fact, scientific world, we think of it as a disease state now too, right? I mean, aging process does not necessarily mean just pure aesthetic.
A perimenopausal or menopausal woman, inflammation, a change in skin sensitivity, redness is a huge symptom of that transition when the estrogen goes out the window. So would you say that this would be a suitable treatment for some of those
Correct.
symptoms?
Correct. So any of the things that we talk about, the seasonal changes, the change of the stage of life changes to the skin, the peri or postmenopausal women, as well as some disease condition of the skin, like any kind of dermatitis, rosacea, for instance, right? So that has been at least studies, the one particular studies from Korea that we have shown to improve it quite well. So that's a skincare period. Once again, is trying to repair the skin barrier disruption. That's exciting. I think we will see a lot more of that. And then from the company's perspective, right, they are also doing intense research on how to actually improve their product. And one of the ways is combine it with, I just can't think of the word, and not a chemical, a natural sugar chain that hopefully not only improve hydration, will actually improve the delivery of the polynucleotide into where we want.
Ready to meet your best self? FutureLab supplements available exclusively at Chemist Warehouse give your body what it needs to stay strong, radiant, and ageless. FutureLab's longevity trifecta, NAD+, berberine, and resveratrol work to support the hallmarks of aging from the inside out. Your entire journey will start with a consultation and then completely customized multimodality process. Can you speak to the difference of what multimodality treatment offers a consumer? Because I think that this is something that you're quite heavily invested in, so you're a good person to speak to it. And certainly from Aesthetics 24, that's what you were presenting.
So the multimodality or the new future clinic, in fact, some of it is already here. I think you will get a proper comprehensive consultation. First of all, let's say we concentrate on your aesthetic requirement. The part two will be we want to talk about the sort of a inner longevity health status because we want you to look good but also live well longer. So that's the idea behind it. We briefly touch about your cardiac health, your heart health, your brain health. Now we also want to talk about your external health. So that's what the first consultation been. And then we work out the priorities, right? So I see that we will get a concurrent treatment. People will walk out with some sort of maybe supplement that will deal with their internal longevity status, be it the heart, brain, the whole package. And then we talk about the skin health. The skin health will involve a lot of things that we have seen now, your laser devices, your needling, your skincare. I think the skincare is going to get a lot better now. And we've recently seen, at least when SkinCeutical, the peptides that we can actually use to deal with some of the surface irregularity and the surface crinkling. And that's very, very exciting. The next step is the regenerative treatment, the regenerative that we talk about, I think there will be a lot more.
And I'm wondering if you could share with us what you see from the perspective of an aesthetic physician and surgeon, the major changes to a woman's face and skin, and where you feel the most effective intervention is, at what age, at what stage, and with what.
Yeah. So menopause is a big. So with the loss of estrogen, it really creates not only just the skin, the whole systemic side. And most women expert in it because they go through it. I'm just going to concentrate on the skin. We lost the collagen. We lost the collagen, at least 20% in the first year. And then, every few years, every year we continue to lose. As a result, by the end of it, our skin becomes so thin, right? That's only one part of it. The disruption of the skin barrier make life so difficult. You have women whose skin are so good, and then they can use anything, and then suddenly with menopause, suddenly they become allergic to every single thing, and that's because the barrier and all this stuff.
What is the role of this regenerative medicine in that life cycle?
Okay. First of all, you touch on the preparation. In the last, previously, when you go for surgery, the surgeon say, yes, okay, fine, let's operate tomorrow. Nowadays, there's a lot of preparation going on. We want your skin to be in the best health. When you have surgery, you are going through some sort of injury. We are inflicting some injury. We're making some cut. So those require healing. So the best way, if you want your surgery and your recovery to be so good and seamless, your surgeon will prepare your skin with some good quality cosmeceutical skincare. We will, after we prepare, we operate. Some of us may deliver some sort of product into the fat area to prep the fat so that the fat is kind of ready to receive fat grafting, to improve the uptake of the fat. Now, when we do fat injection to the face, a lot of time only a portion of the fat will survive.
You're listening to the highlights edit of a longer episode. If you enjoyed this clip, be sure to download and listen to the full episode.